Our message today is that as the Supreme Court hears the arguments on the constitutionality of the law, we want Ohioans to remember that the Affordable Care Act is already helping hundreds of thousands of Ohioans to get lower health care. Is already helping hundreds of thousands of Ohioans and will help millions of Ohioans when it's implemented.
Give us some examples.
Well, today, insurance companies can no longer cancel your coverage just because you get sick. Children are able to stay, young adults who don't have health coverage are able to stay on their parents' coverage until age 26. People on Medicare who reach the so-called donut hole, the gap in coverage that happens every year, to a quarter of Medicare recipients are getting big discounts on drugs in the donut hole, saving $2.1 billion to people on Medicare. So there are lots of ways in which the Affordable Care Act is already helping. There's a high-risk pool in Ohio that's helping around 2,500 people who are shut out of the insurance market. Children can no longer be denied coverage because of pre-existing conditions. Lots and lots of provisions. No cost sharing for preventative care for people. So these are already helping hundreds of thousands of Ohioans. There's an end to lifetime caps on health coverage. So if you get sick nowadays, you can't max out on your health insurance and find yourself uncovered the way you could before the Affordable Care Act. Now in 2014, around over 1 million people will be getting affordable health coverage through the Affordable Care Act. So the arguments before the Supreme Court, which are driven by politics and driven by attorneys general, including Attorney General DeWine, who dragged us into this lawsuit, are hurting Ohioans.
Dragged us into it. Ohio voters said by a 2-to-1 margin they didn't like the mandate that everyone get health insurance, and they even voted to put that into the Constitution, some kind of exemption for Ohio. At least that was their intent.
Bill, you and I both know that people who voted for the Health Care Freedom Act did not know the consequences of the provision. They did not understand what they were voting for. And you talk about health care freedom. I heard last night about a woman who goes to her job that she hates every day. She doesn't get 2 days off in a row. And she tells herself every day, I'm doing this to keep my health coverage, because she's uninsurable in the individual market. People with pre-existing conditions don't have freedom today. People who can't afford coverage and don't have job-based coverage, they don't have freedom today.
So if you had your druthers, DeWine would not have joined the suit?
Absolutely. DeWine would not have joined this lawsuit, which is being done for political reasons. And when people understand the benefits of the Affordable Care Act and how it works to guarantee coverage, affordable coverage to everybody, regardless of pre-existing conditions, more and more people like the Affordable Care Act. The problem is most people don't understand what the law does.
There were hundreds of people out in front of the federal courthouse protesting this on Friday. You have maybe a dozen here right now. Are you saying all those people on Friday just don't know what they're talking about, but these folks do?
The people who were out protesting on Friday were claiming to be protesting the imposition of a requirement around contraception on the Affordable Care Act, and they were protesting the Affordable Care Act. In terms of the contraception issue, if you took a poll of women, most women of childbearing age support access to contraception as a part of comprehensive health coverage. And the administration, the Obama administration, put forward a reasonable compromise to protect the religious tenets of institutions that don't want to pay for contraception. But contraceptive coverage is a part of comprehensive health coverage. And to think that women should be paying for, to think that health coverage should not pay for contraceptive coverage is absolutely absurd.
Does it really matter whether this Attorney General in Ohio joined the national suit? It would be going on anyway.
Well, yeah, it'll be going on anyway, but we want to send a message to Attorney General DeWine that he's kicking Ohioans in the teeth by supporting this lawsuit, because the Affordable Care Act is benefiting so many Ohioans who right now have a lot of insecurity around health care.
When DeWine ran for Attorney General, he made that one of his campaign stands. He said, the first thing I'm going to do is join the national suit against this law. Ohioans voted for him.
And the Ohioans who voted for, many Ohioans say that they're against the Affordable Care Act because they don't understand what the Affordable Care Act does. We have a real problem in this country that most people don't understand how the law works, what benefits it offers to people. I mean, you ask people, should anyone be denied health coverage because of a pre-existing condition? And the vast majority of Americans and Ohioans say no. It's not right for people with pre-existing conditions to be denied health coverage or to be charged absurd premiums like $30,000 a year for health coverage because they have a pre-existing condition. That's not what health coverage is for. Health coverage should be to protect all of us, because any one of us can have a pre-existing condition. And yet people say they're against the Affordable Care Act, which is designed to protect people with pre-existing conditions and make sure that everybody has access to affordable coverage. So clearly, when polls show that when people understand how the law actually works, they support it. But in our absolutely polarized political environment, where the Affordable Care Act is being used as a political football, most people don't understand how the law works.